Story 1. I had a psychologist tell me once that a sane person will accept the immediate circumstances and quickly identify the best exit strategy to fit in, whereas a person who is not will fail to recognize or come to grips with the situation and escalate it until it has gone too far. This is just secondhand information from an interesting conversation. Story 2. I am approaching this from the perspective of someone who was an intern on an acute psychiatric unit. As long as the facility has no ulterior motives for keeping you there and no outside influences sharing stories, I believe I would stay for at least another week before being discharged. Story 3. Imagine the entire world's population is against you. It would be nearly impossible to convince the majority that they are wrong without a few strong allies to support you. The same applies to a mental health facility. By the time you are admitted, it is already too late to prove otherwise. Story 4. I was taken to inpatient psychiatry twice. The first time, I talked my way out of it. The biggest thing in my experience is to try to stay coherent and logical. It worked the first time, but the second time I apparently wasn't successful. I spent a week there. I do not recommend it at all. Story 5. That's a scary thing. If some people decide you are crazy, the more you try to prove that you are sane, the more you will appear crazy to them. Story 6. Is it a nice psychiatric hospital? I might just stay there until they observe me long enough to determine I'm okay. I don't want to use resources that others may need, but if I am going to be admitted against my will, I think a little break from the outside world could be nice. Story 7. Most psychiatrists will just figure it out. I don't have any severe social or mental issues. I don't hurt myself or hurt anyone. I follow rules, take medications, and attend therapy. Story 8. I wouldn't try to prove my sanity if I were put there. I would live a simple life. Everything for free by case choice. Story 9. You actually can't. I talked to a completely sane person there once, and they kept him in for way too long. The only thing was that he was overly religious, but that's it. Story 10. This actually happened to me a couple of years ago. My father lied and framed me as severely mentally ill to have me institutionalized. I became the so-called model patient, participating in every activity, respecting and helping everyone, and following rules. I complied with everything. When possible, I asked what he was telling the treatment team and provided them with the necessary context. Whatever he conveniently left out and lied about. It also helped that I displayed no concerning symptoms of mental illness. I was discharged after 18 days. It could have happened earlier, but I didn't want to return to my parents and was exploring different places to live. It took the staff a week or two to believe me. I was 17 after all. Kids aren't people and all parents are perfect. Story 11. I believe I could leave if it were a decent place. If they observed me for a few days, I think they would realize there is no reason to keep me there. I hope I never find out. I have visited someone in several different hospitals. Even the better ones are worse than prison, in my opinion. Story 12. That situation is straightforward. No matter what you say, they will not believe you since you are in a psychiatric hospital. What they are looking for to discharge you is improvement. Of course, you cannot be more sane than sane, so you just have to condition them to a less favorable version of yourself by acting, to make it seem like the medication is effective when you return to your normal self. Story 13. I know this is not the question, but I don't really think it would be necessary. I went to the psychiatric ward a couple of years ago because of psychosis, depression, and suicidal thoughts. I had decent insurance, and they still let me out after 5 days. Around day 2 or 3, I told a nurse that I kept thinking about stabbing the person I was rooming with in the throat with a pencil because they were snoring so loud I couldn't sleep. I was very graphic about it. They ended up moving them to a different room. I went home a few days later and never actually harmed anyone. I'm not sure if this encouraged them to let me out faster or if they just generally didn't care. Story 14. This is a long and true story, so I will indicate where the answer to the question is. One time I had thoughts of self-harm, so I checked myself into the hospital. I had done this before, so I kind of knew the flow of things. When I was transferred from the first facility, it was to a different area than what I was used to. I just assumed it was a different entrance. The place I was taken to felt like the slums. It reminded me of an uncared-for setting from a movie. There weren't many people there. The staff seemed indifferent, and the patients were detached, as if they were not on this planet. There was one guy who appeared level-headed, but his story is a separate matter. Anyway, I arrived at this place, and they looked at my chart, saying, "Okay, take him to the holding area." I asked, "The holding area? Like a cell?" They took me to one of those stereotypical padded rooms where you often see someone in a straitjacket in films. I think there was a mattress inside. When I asked why, the nurse said, "The previous hospital states you tried to choke yourself with the heart monitor cable." I insisted that did not happen, but they told me I had to stay there for a while, like a couple of hours, so I just went in and slept. Eventually, I realized this was a place for people who were genuinely struggling with mental health issues. I gathered my thoughts and started a small conversation with a nurse about random topics. Eventually, I managed to express, "I don't need to be here." The nurse quickly agreed with me. I demonstrated that I could have a basic conversation, something that many others couldn't. She mentioned I had to talk to the doctor, but since it was Sunday, I would have to wait until Monday. I got a couple of sheets of paper and a pencil, and spent the next few hours in my room writing out my explanations for why I didn't need to be there, and how prolonging my stay would only worsen my situation. I did that until I went to sleep. The next day, I saw the doctor, and he understood my point quickly. He was able to arrange for my discharge the following day. He said something that I will leave you with. "Who is your best friend?" I began to say a name before he interrupted me. "Wrong. It's you. You are your own best friend." Story 15. I calmly state that I feel good enough to leave in a week. I will continue to sleep at night, eat meals, take my medications, and make no trouble. In my personal experience, that approach works faster than a week when COVID is all around you and the hospital feels like the safest place. I don't understand why. Story 16. I would not. A grippy sock vacation sounds exactly like what I need. My last manic episode should have landed me in the hospital. Story 17. I have less experience in this than many others, but I worked in an inpatient psychiatric unit for a while. It is usually easier than most people think. Physicians are generally quite good at their job and do not want to keep you longer than necessary. Daily evaluations can indicate your progress. Even if you are not fully stable, having that insight makes treatment and discharge much easier. Story 18. Try getting placed in a psychiatric hospital. I dare you. It is nearly impossible, at least in my country. Story 19. Yes, of course I get upset sometimes. But like you, I am calm and collected. I don't think it's anything out of the ordinary. Very well, just one more question, which is standard in this situation. Can you tell me who the President of the United States is right now? Doctor, you won't believe it. The purple aliens are back. Story 20. You can't really. I would follow the program and do everything required of me. Hopefully, that should be enough to secure my release. But who knows? Maybe I'm not fully sane. I can always do with a rest. Story 21. I would put in a lot of work to study what being sane looks like, and then I would adopt it like a skin suit. Story 22. Look up Tony in California and John Ronson's book, The Psychopath Test. Once you are in, it can be hard to get back out. Story 23. I am taking my medication, so leave me alone. My friends will say, "Yes, that's our person. Let him go." Story 24. I love the insurance response someone else provided, but I am in the UK, so unfortunately, that wouldn't work for me. After giving it some thought, I will be as cooperative as possible until my husband comes to help me. Story 25. I would break the glass windows in the rooms where they lock me in and attack the staff when they try to give me medication and food. The last time I was there, I was stuck for about 4 months. Story 26. If asked whether I would empty a full tub with a spoon, cup, or bucket, I would tell the psychiatrist that I would simply pull the plug. Story 27. I don't believe that you could. I was very ill once, and they kept diagnosing it as anxiety despite imaging and lab work showing otherwise. They threatened to admit me to a psychiatric ward several times. I almost died and was going into cardiac shock. I was experiencing a thyroid storm. After that experience, I don't think you can convince them of anything. They believe they are the experts and do not want to listen to a thing you say. If you oppose them, they threaten you. Story 28. First, I would ask why I was there. Then I would calmly and rationally try to disprove the reason with logic. Story 29. I would say, why do I want to leave? I have a gym, food, a bed, and air conditioning, and I do not have to lift a finger. Story 30. Based on my experience with 4 hospitalizations, it's common to need a few weeks to adjust without feeling overwhelmed. The psychiatric wards I have attended seem to understand that people may experience delusions, but they ensure that patients reach a stable state before safely reintegrating into society. Story 31. Billy says I shouldn't be here. He says hi. He doesn't like it here. Let me out. Just kidding. He actually said to just wait until I go to sleep, so I will. I'll wait. Story 32. I need to request a work note. A 72-hour hold will keep me out for at least 1 day. I would also like to know if I can participate in activities during this time. Story 33. It depends on the circumstances surrounding your situation. Has someone else contacted you? Is law enforcement involved? Have you made any written or recorded threats or statements? Do you have a history of mental health issues? Or is this your first encounter? Do you have a job, children, or a person you can talk to? Do you have support in the community? Most admissions are based on risk. If you believe you are being admitted unjustly or for retaliatory reasons, just stay calm. Speak in a normal tone. Do not act irrationally or aggressively, and avoid pacing or seeking an exit. Refrain from socializing with other patients or getting involved in drama during the initial evaluation. In many states, you can legally challenge an involuntary admission, but this process takes time. Story 34. So, do I get paid while I'm here? Because if I don't show up to work for a long period, I doubt I'll have a job to go back to. Story 35. I believe that users on Reddit would spend their time bothering doctors to get them to diagnose all the conditions they claim to have. Story 36. I don't need to. Unless I am a danger to myself or to others, they won't even admit it, and even then, it is tricky. They let you out in about 3 days anyway, so just avoid doing anything that would suggest either of those, and you are free. If you want one phrase, they think that forcing me into an involuntary commitment will have me locked up permanently. They are not interested in my well-being. They are trying to abuse the system to take advantage of me. This leads people to investigate further. Story 37. I remember the names of my psychiatrist and therapist and the dates I last saw them. They called and let me go. Story 38. I once watched a documentary about early-onset dementia. A man in his 40s who had been a dentist was convinced that the ward he was in was his dental office and the other dementia patients were his patients. The staff humorously allowed him to do his work, obviously without tools. He was perfectly happy doing his rounds and checking on everyone's dental health. My question is, what evidence do I have that everyone around me isn't humorously treating me in the same way? How do I know I'm not a dementia patient in a ward? Could I prove it? Story 39. There really isn't a one-size-fits-all answer to this question. A lot depends on why I have been put here, by whom, and under what circumstances. If this is a case of mistaken identity, then a charming but insistent conversation with the nurse, accompanied by just the barest hint of not wanting any legal escalation, would probably be enough to get me an earlier audience with the doctor. A 5-minute conversation will make it very obvious that I'm not the person they think I am, since they would have seen that person, and I'm absolutely nothing like them. Another route is to gather collateral information. If I ask my family to visit or ask my boss at the hospital to call, that type of collateral information will very quickly disprove whatever is being alleged about me. But let's say it's different. Suppose I had a psychotic break or was under the influence of some unknown drug, which led to my commitment. Honestly, there is very little I can do to leave in a few days or a week. A big part of what they do is screen people to ensure that they are stable and will remain that way. So simply being my usual effervescent self and working with the couple of days I have in the group is all that it will take for me to leave as per routine on the next cycle. Now, let's say it's sinister. Suppose I suspect I've been placed here due to lies told to the system with the specific intent of getting me out of the way. Let us further assume that the psychiatric staff is in on it. In that situation, getting a message to someone on the outside is my best hope of escaping this wrongful imprisonment. Yet, I need to be extremely careful not to come off as paranoid and be dismissed. Faking a medical illness typically alarms psychiatric staff and prompts them to call an internist. This gives me at least one objective person to work with. I would wait a few days to figure out what I was being labeled as, so I know how to present myself. When I finally have a chance to speak with that medical provider, I would explain that there is some strange nuance in my medical history and give them my mother's phone number, as she knows it better than I do. There is no way a doctor would not follow that up. The moment my family learns that I'm being held in a psychiatric facility, I don't have to do anything else. They will keep pushing until the doors come down and I get out. Story 40. There is a book that discusses this topic. It is called The Psychopath Test by John Ronson. Story 41. I wouldn't be able to. I have been diagnosed with multiple mental illnesses since I was 17. I can guarantee they would think I'm having a manic episode because I would be very upset and stuck in that situation. Just accept the vacation and move on. Story 42. Why am I in this? What do they have on me? If I don't know that, how can I prove I am sane? I suppose I will just keep living my life as I do. Story 43. Studies and experiments involving individuals who have been committed have shown that so-called professionals often cannot distinguish between sanity and insanity. Therefore, acting calmly while accepting the situation or professing one's sanity at every opportunity and refusing to cooperate results in the same outcome. So my strategy: profess sanity and cooperate. Let them know I do not deserve institutionalization, but do not actively fight or attempt to escape. Story 44. That's not how being in a psychiatric hospital works. You don't prove you're sane. You prove you're not a danger to yourself or others. If you're already there, you'll be there for a while. Story 45. From personal experience, you just do not cause any trouble. Psychiatric hospitals are massively underfunded, and there are many people who could use a bed. Nobody wants you there. Their goal is to get you out as quickly as possible. They are not trying to keep you there. If you show that you are not an immediate threat to yourself or others and say you will get help when you are out, that is really all that matters. The goal is to stabilize you to the point where you are not actively attempting to harm yourself or others, you are not experiencing a psychotic break, and you are not being violent or disorderly. Then they will get you out so they can bring in someone who actually is behaving that way. The idea of being sane in insane places from the 1960s and 1970s is misleading. Psychiatric holds are not placed on patients because society wants a way to remove people from public view. The objective is to quickly administer medication so they stop behaving violently and then discharge them. Story 46. What is this sanity you speak of? All day long, I have people approaching me, exuding vibrations. Really, what is sanity? If that's not crazy to you, then maybe you should check in. Story 47. I wouldn't try. My behavior would probably prove that. If it doesn't, then maybe I could use a stay. Story 48. Jada threw a large green chair at our group therapist, and I sat there looking at the startled therapist, thinking, yes, I'm not supposed to be here, ma'am. I was horrified by all the antics at the mental health facility during my stay. I was complaining about the food while some people were having calm needles administered. Story 49. I have been really frustrated with my job and have been working overtime. I have been there for about 2 years. 5 months ago, I was promised a promotion, only to discover that the manager's position I should have taken is receiving favoritism and is not progressing. I lost my composure and became very upset. Story 50. Be patient, polite, and bored. That's the only thing you can do. I would try to refuse antipsychotics, but not very strongly. I just know they can negatively affect you, and if my way out was to accept them, I'd reluctantly agree. For the most part, simply explaining my own medical history, easily backed by medical records, would show that I am in fact sane. Sure, drilling my own teeth isn't something most sane people would do, but I wouldn't share that. Besides, I did a good job. I'd also admit to the substance use that led me there. I mean, how else did I end up in that situation? Maybe I took 750 micrograms of LSD and a bottle of dextromethorphan, I don't know. But once it wore off, I just acknowledge it. Remember, kids, being under the influence of drugs is not illegal. Being in possession of drugs is, unless you're driving, then they are both very illegal, unwise, and dangerous. Story 51. I was in one before and I told them that I was very happy and that I wasn't thinking of harming myself. Story 52. Being staff at one of the state-run hospitals in Pennsylvania, we can immediately recognize a truly sane person. The staff serves as the true test. Story 53. It is almost too late to prove otherwise, but if you are in sound mental health, as others have stated, take it for what it is. Be respectful and well-spoken to the staff and simply try to play the part. That is really all you can do. Story 54. You talk to the therapists and the patients. The patients can recognize a sensible person from a distance, and so can the therapists. My dad worked in a mental health facility as part of his pastoral training. Story 55. Hi, I'm really struggling with my mental health. Can I have some support? That usually gets me ignored by any medical professional and sent away. Story 56. Honestly, if I ended up in a psychiatric hospital, I would probably think there was a good reason for it. Story 57. I would hold up my index finger on both hands and say, one of my fingers always tells the truth, and one always lies. Ask one of them if I am sane. Story 58. Continue to act calmly and wait for them to realize their mistake. This is by far the most effective approach, unfortunately, as you are likely on hold, and throwing a fit will probably just result in a longer detention. Story 59. I would remain calm until I identify patterns and sources for weapons. Then I would take a hostage and use them to secure my release, allowing the courts to determine if I should be there. Story 60. I have been involuntarily admitted to the psychiatric ward many times. The typical stay is 3 weeks long. They will eventually discharge you, regardless of your progress. It is not a free place to live. It is where you remain long enough to lose your job and fall behind on rent. Follow all the rules, take your medication, and avoid conflicts with others, or your stay could extend for months. However, it is not a permanent situation. Keeping you costs money, and those costs become harder to justify over time. Being mentally stable is not a requirement for discharge. You still have schizophrenia when they walk you out and you are standing outside the building. Story 61. Those hospitals are designed so that, in most cases, you simply can't leave. If you are there, you are ill, and there are no other options for doctors. The best you can do is convince the doctors that you are in remission. Be very calm, answer questions with simple, short responses, and try to act as neutral as possible. Imagine that you are a rock. You have no desires, dreams, or interests. You are calm and uninterested in anything at all. Story 62. You do not have to prove anything. I have been disabled for a long time, so a hospital is just a hospital. There is no need to prove anything. Many new patients try the adamant approach of asserting, "No, really, I'm not crazy," during their first week, protesting the use of medications, which often lands them in trouble. Just do your time, keep your opinions about your personal beliefs to yourself, avoid complaining about legal actions, take your prescribed medication, manage your expenses, and if you can afford it, consult a lawyer before or after the event to assist with financial matters, but not during. Hospitals do not care. They are focused on creating stability, normal eating, sleeping, and personal hygiene. They provide activities of daily living. They are not confession booths, nor places for experimentation with disruptive behavior to seek negative attention. Hospitals do not concern themselves with whether the chairs are uncomfortable or if the floors have not been cleaned in a month. To put it simply, hospitals do not care even if you are sane. There was a psychologist who conducted an experiment, admitted himself, and found he could not leave. Expect to hear the mantra I've heard everywhere. A 72-hour hold, followed by emotional manipulation and unmet expectations, which typically extends to at least 3 weeks. Discard any hopes of an earlier departure. A hospital is not a religious place to discuss your views on how the world works, nor can you absolve yourself through confessionary behavior to become normal or sane again. Unfortunately, many people misinterpret this as a form of social debt collection. It is not. Mental health facilities should not be used as means for social debt collection. They are designed to sedate you until you are in a state where you no longer remember your emotions, and that is their aim. Ultimately, you will realize that disparaging remarks and microaggressions, such as, "take your medication," and "he needs a mental health evaluation," are forms of hate speech. The mindset of "you're crazy" and "I'm normal" is toxic. Even pointing out a diagnostic label like schizophrenia is a microaggression. It should not be used as a tool by anyone against others. Story 63. My entire childhood, I was in and out of mental hospitals. It does not work like that. I promise you, you get out when they choose to let you out, and no earlier. They decide that you are sane. It is a choice, not a matter of convincing. There is nothing you can do. Nothing at all, not a single thing. Story 64. I have studied Irving Goffman and Michel Foucault. I could not prove I was sane. I could only convince them that I was compliant and non-threatening. That is what they are really after all. Story 65. The only way out of a psychiatric hospital is to do as the staff asks of you. Show that you are compliant, willing to take your medication, and not causing any issues. Only then will they allow you to leave once they are confident you will continue your treatment plan. I once checked myself into one, and that was the only way they would let me out. Story 66. Honestly, I could use a break, and the world isn't making much sense to me right now. I might just hang out and see where that takes me for a while. Story 67. I can talk my way out of anything. I bet I could do it. Maybe I could even make them realize their personal struggles in the process. Story 68. I wouldn't. I'd ride out the 3-day hold and hope I'm crazy enough for them to offer to keep me for a few extra days. Story 69. I'm sorry, is it illegal to be insane? If you are not a danger to yourself or others. There was a person who claimed to be Napoleon and rode a horse around. Apparently, he was an amusing individual. The Fisher King? In this context, I'm not sure how to answer the question as it is presented. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.